Joining me now is Dr Fred Volkmar. He's a professor for the Child Studies Centre at Yale University School of Medicine and editor-in-chief of the Journal of Autism and Developmental Disorders. Thank you so much for your time there. Now, this month of recognition was recently changed from Autism Awareness Month to Autism Acceptance Month. Just tell me more about why this change of wording matters.
Well, I think the real, what the issue really speaks to in terms of the word change is not just the awareness, but really doing something about doing something about it, not just being aware, but really thinking about making appropriate accommodations, including people whenever possible, really being more accepting and inclusive of people with autism spectrum disorder in routine daily activities.
For the parents with young children, what are some of the early signs of autism, and how does autism range across the spectrum, and how does it develop into different types of autism as people grow up into adults?
A good question. Often parents are worried in the first year of life, sometimes because the child is delayed in developing language. Sometimes the child seems not to respond to some, but not all sounds. Sometimes the child seems socially unrelated. Often a diagnosis is not made until 1 to 3 years of age. Almost always by age 3, children are showing all the signs. And it's those first few years of life that are so critical in terms of identification and intervention.
And in terms of initiatives, we got a little bit of an understanding in the report just earlier, but what kind of initiatives or developmental tools still need to come into society, onto the market, to help support people who have autism into adulthood, but also to support their parents?
Well, I think we need a number of things. First of all, we need better access to research-based interventions, which have been making such a really important difference for so many people with autism spectrum disorder. I think another thing is better access to some of the technology supports, which can be really very, very helpful. Some of these are very low tech, some are very high tech, but they all have a role in terms of helping people with ASD adapt and communicate more effectively.
Okay. Now, according to the CDC, autism rates have increased from 1 to 150 children in the year of 2000 to the current rate of 1 in 44 children. What do you say to those numbers, and what are the factors that led to this increase?
Well, I would take those numbers with a certain grain of salt for many reasons in terms of some aspects of the methodology. Also, I think one question is, in the United States in particular, the autism label often gets parents the most services for a child. Parents are more aware of autism as a label, and it's a much more hopeful label than it used to be. So there's a certain push to get the label of autism, not only to get services, but to be more optimistic. And that's one of the problems sometimes, depending on how the study is done. If the study is done really based only on school designation without real assessment of the child, we can get somewhat inflated estimates.